Did you know that more than 70% of strokes occur in people over the age of 60? And the most serious part is this: most of them do not happen suddenly, but after years of ignored warning signs. Small alerts that are confused with fatigue, high blood pressure, or things of aging, until the damage is already done. Today, I want you to stay until the end, because you will understand how a stroke develops silently, which signals should never be ignored, and what concrete decisions can reduce the risk starting today. I am Dr. Sinclair, and this space exists to help you protect your brain and your independence. A stroke, or CVA, occurs when a part of the brain stops receiving blood adequately. The brain depends on a constant flow of oxygen and nutrients to function properly. Unlike other organs, it cannot store oxygen reserves. This means that when circulation is interrupted, even for just a few minutes, brain cells begin to suffer damage immediately. The longer the brain goes without blood flow, the greater the damage and the lower the chance of recovery. This lack of oxygen directly affects the functions controlled by that area of the brain. That is why a stroke can cause severe and permanent consequences, such as difficulty speaking or understanding words, loss of strength or mobility in an arm or leg, vision disturbances, memory problems, changes in character or personality, and in the most severe cases, death. It is not just a temporary event. It is a brain injury that can change a person's life and the life of those around them. There are two main types of stroke. The most common is ischemic stroke, which represents approximately 80% of cases. This type occurs when an artery that carries blood to the brain becomes blocked. That blockage is usually caused by a clot or by the gradual buildup of fat and plaques on the walls of the blood vessel. Over time, this narrowing reduces blood flow until it eventually becomes completely blocked. The second type is hemorrhagic stroke, which is less frequent but generally more severe. In this case, a blood vessel ruptures and causes bleeding inside the brain. This bleeding compresses brain tissue, increases internal pressure, and causes rapid damage. Both types of stroke are medical emergencies that require immediate attention, but ischemic stroke is clearly the most common in people over the age of 60. The key question is, why does the risk of having a stroke increase so much with age? After the age of 60, the body goes through natural changes that affect the circulatory system. Blood vessels lose elasticity, arteries tend to stiffen, and they become less able to adapt to changes in pressure. At the same time, risk factors begin to accumulate. Poorly controlled high blood pressure, high cholesterol, diabetes, past or current smoking, sedentary lifestyle, and inadequate dietary habits. These factors usually do not cause pain or clear symptoms in the early stages. They do not warn you. They do not give obvious signs. But internally, they slowly damage the walls of the arteries, promote plaque formation, and alter circulation. It is a silent and progressive process. When an important symptom finally appears, the damage is often already advanced. For this reason, a stroke should not be understood as an isolated event, but as the final consequence of years of vascular wear and tear. Understanding this process is essential to understand why prevention, control of risk factors, and early detection make a real difference after 60. Many people believe that if they do not feel pain or dizziness, their brain is fine. But stroke rarely announces itself with pain. Its signals are usually subtle, brief, and easily ignored. A sudden difficulty speaking, even if it lasts only a few minutes. A strange sensation in an arm or a leg. A momentary loss of strength on one side of the body. Blurred vision in one eye. Sudden confusion. Many times these episodes last a short time and resolve on their own. This is called a transient ischemic attack, and it is a serious warning. It is not something minor. It is the body saying that the brain was about to be left without blood flow. Here lies one of the most dangerous mistakes in older adults: minimizing the signals. Thinking it passed, I must have slept badly, it's my blood pressure, or it's nerves. Each of these phrases delays a diagnosis that could prevent a definitive stroke. The brain does not warn twice in the same way. Many times, the small warning precedes a major event. Another key point is understanding that stroke does not depend only on the brain. It depends on the heart, the arteries, the blood, and daily habits. Poorly controlled blood pressure is the number one risk factor. Even slightly elevated values maintained for years damage the cerebral arteries. The same happens with high cholesterol, which promotes plaque formation that narrows blood vessels and facilitates clot formation. Diabetes also plays a central role. Excess glucose damages blood vessels from the inside, makes them more rigid and less efficient. And a sedentary lifestyle worsens the entire scenario. It reduces circulation, promotes excess weight, and increases overall inflammation in the body. But here comes an important and, at the same time, deeply hopeful truth. The risk of suffering a stroke can be reduced even after the age of 60. It is not about turning back time or denying the body's natural changes, but about changing direction. The brain retains the ability to protect itself and adapt when given the right conditions. Many people believe that after a certain age there is nothing left to do. That idea is incorrect and dangerous. One of the fundamental pillars of prevention is regular blood pressure control. It is not enough to measure it only when symptoms such as dizziness or headache appear. Hypertension is often silent and constant. Slightly elevated values, sustained over years, damage the walls of the cerebral arteries and significantly increase the risk of stroke. Monitoring it regularly and keeping it within appropriate ranges directly reduces the probability that a vessel will become blocked or rupture. Diet plays a central role. There are foods that accelerate vascular damage without the person realizing it. Among the most problematic are ultra-processed foods, cured meats, very fatty meats, fried foods, industrial baked goods, salty snacks, instant soups, and prepared meals with high sodium content. Excess salt raises blood pressure, while saturated fats and simple sugars promote inflammation and hardening of the arteries. When consumed regularly, these foods create fertile ground for stroke. It is also important to limit the consumption of sugary drinks, industrial juices, and products with a high glycemic index. These rapidly raise blood sugar, damage blood vessels, and increase risk, especially in people with diabetes or insulin resistance. But just as there are foods that accelerate risk, there are also foods that actively protect the brain. A diet rich in vegetables, especially leafy greens such as spinach, chard, or broccoli, provides antioxidants and helps keep arteries more flexible. Whole fruits consumed in moderation provide fiber and protective compounds. Fish, especially fatty fish such as sardines, mackerel, or salmon, are an important source of omega-3s, which reduce inflammation and improve vascular health. Olive oil, nuts in small amounts, legumes, whole grains, and adequate hydration contribute to better functioning of the circulatory system. It is not about a strict diet, but about consistency. What you eat every day has more impact than what you eat occasionally. Another key pillar is daily movement. It is not necessary to perform intense exercise or demanding routines. Walking regularly, maintaining age-appropriate physical activity, getting up frequently if you spend a lot of time sitting, and moving every day help improve circulation, control blood pressure, regulate blood sugar, and keep the heart more efficient. Sedentary behavior is one of the factors that most contributes to stroke risk, even in people who feel fine. Rest also plays an essential role. Poor sleep, short sleep, or fragmented sleep raises stress hormones, increases blood pressure, and promotes inflammation. Restorative sleep helps the brain regulate key functions and reduces vascular wear. Sleeping well is not a luxury. It is a real preventive measure. Finally, regular medical checkups make a decisive difference. Checking blood pressure, cholesterol, glucose, and heart rhythm allows problems to be detected before they cause greater damage. Many people suffer a stroke without knowing they had hypertension, high cholesterol, or arrhythmias. Prevention begins with knowing your own health status. These actions may seem simple, but they are not. They are decisive. Each daily adjustment, sustained over time, reduces the real risk of stroke and protects brain function, autonomy, and quality of life. After 60, prevention does not mean exaggeration. It means taking care of yourself with information and determination. It is also essential to understand the role of medication when it is indicated. Many strokes occur because people stop or adjust medications for blood pressure, cholesterol, or diabetes on their own. These treatments are not optional preventive measures. They are brain protective. Stopping them without supervision silently increases risk. A stroke does not only affect the body, it affects independence, social life, self-esteem, and quality of life. That is why preventing it is not only a medical issue, it is a personal care decision. It is not about living in fear, but about living with information. Recognizing the signs, acting quickly, and reducing risk factors can make the difference between an autonomous life and a life limited by avoidable consequences. The brain is the center of everything you are: your memory, your identity, your ability to decide and move. Now that you understand what a stroke is, why the risk increases after 60, what the warning signs are, and what concrete actions can truly reduce the probability of suffering one, tell me in the comments what you think you could improve to prevent it. And also write in the comments, "I protect my brain," so I know you stayed with me until the end. Because yes, health, that comes first.